So I will share a few things on our end from Carter County Drug Prevention. We, on our Facebook page, we have several events posted that are community events everybody's welcome to come to. There are 3 summer camps that we're doing in July, free breakfast for kiddos, and then just different activities for them. So if you have anybody that would be interested or you want to spread the word about that, please feel free to do so. We also are partnering with some organizations to host a gun safety class. And so I'm not sure if Ms. Norma's on here or not, but Tri-Cities Moms Demand Action provided gun locks for us to hand out at that event. And there'll also be just information about the new permitless carry law and kind of making sure we're keeping our kiddos safe around all those things. So those events are all on our Facebook page. If anybody wants to share them or has anybody that might want to come. I'm also going to ask Tia to pop in. I know she has an event she wants to share as well.
Hi, so I just wanted to take a second. So we are partnering with Olson's Martial Art Academy and Amy Matley. So she is trying to get her black belt. So on July 23rd, we're going to have a family awareness night at Harmon Park from 6 to 8:30. So we're going to have pizza and activities for the kids. And then we're also going to do a scavenger hunt. So what we really need is people to come out and set up tables. So that way we can get these kids to come and, visit your table and your resources. So if you would like to be a part of this or come and set up a table for this night, so we're really paying attention to suicide and bullying awareness. And so we would love for a lot of people to come out and share their resources. You can email me at tia@cartercountydrugprevention.org, and we can get you signed up and ready to go. Thanks.
Thanks, Tia. Anybody else have an event they want to share?
Jillian, I would like to mention that the credit union is hosting a lunch next, it's on the next Thursday on the 14th. And it's really for for-profit businesses at the Compassion Center. I know Brandon did a lunch for all the nonprofits, but we're just so hopeful that if we can get businesses involved, they can contribute money and help. So if you all know anyone that is an entrepreneur or a business owner, we're providing the lunch and would love to invite them. All they would need to do is call Andrea at the credit union and let her know that you can come. Thanks.
Thank you, Kathy. I'm going to put some more information about that event on the agenda now, so y'all will have it. And then I'll also add a flyer about Tia's event as well. So those both should be on the agenda for you in just a few minutes. Thanks, Kathy. Anybody else have an event or activity coming up they want to share about?
Hey, Jillian, it's Shelly from the Boys and Girls Club in Elizabethton. We have actually a pitch hit and run event that's coming up on Monday. It is for all kids in the community. It's not just for our club members. So it's from ages 5 to 14. It's a grant from Major League Baseball. And so each kid will pitch, and it's not how fast you pitch. You've got a target you've got to hit. You get points for getting close to it. Hitting is the same. And then, of course, running is self-explanatory. You get points for each area, and then the winner of each age group will get a $100 cash prize and an MLB t-shirt. So it is open to the community. We want to make sure we share that with everyone who wants to. And it's baseball and softball, and the age groups are 5 to 14. So they can go to our website to register. Super easy registration process too. It's all free.
Thanks, Shelly. We have hosted that event in the past and had so much fun with it. It is definitely an awesome day. So if you have any kiddos in that age range, take them out there and let them do these fun activities. So
yeah, it's at the River Riders Field.
Okay. If you want to, actually, I think I have information about it. I'll add information about it to the agenda as well, so y'all will have it. Thank you, Shelly.
Thank you.
Anybody else got anything? Okay, well, we will go ahead and move into our next part of our agenda, which is our sharing session. So today we have John Knack with us from Creekside Behavioral Health, and he's going to share a little bit more about his programs. So I'll turn it over to him.
John, I think you're muted.
I got my video working and was so proud I forgot to turn on the sound. So Sarah Peace is on also from Creekside. She's going to do the second part of the presentation about our our outpatient IOP and PHP programs. But I was just going to go over, what Creekside is in terms of inpatient and a little bit about our program for crisis stabilization. So Creekside is open in Kingsport 24/7. We do free assessments around the clock. We are a psychiatric hospital, 72 beds, 52,000 square feet. We have 3 open courtyards, 2 classrooms. We have private counseling. We have a gymnasium. We have a cafeteria. Patients do not eat in their rooms. They eat in the cafeteria. We have 5 different units at Creekside. We have a children's unit that's ages 9 through 13. We have an adolescent unit that's 14 through 17, or high school graduation. And then we have an adult unit. We have a detox unit, and we also have a senior or a gerio unit. Our average length of stay is somewhere between 7 and 8 days. Our goal is to stabilize and give someone the tools while they're with us, so that when we hand them off to the next resource, whether it be a therapist or group living or a 30-day or 90-day residential facility, that they have some added skills. And everything we do is pretty much group-based therapy. We do offer an individual session at least once a week, and they have access to the psychiatrist and his team. They can request a family session while they're with us also. And our team consists of psychiatrists, nurse practitioners, nurses, therapists. We have a dietitian on staff. We have individual, group, like I said, family therapy. We have rec therapy, art therapy, yoga therapy. And again, we are open 24/7. We take all Virginia Medicaid, all TennCare, all Medicare, and most commercial and private insurance. Dr. Patel is our medical director. And if anyone ever wants to do a tour with a couple of coworkers to tour Creekside, just let me know and I'll be glad to set up a tour. At the end, if you have any questions, let me know. I was going to turn it over to Sarah Peace now, though, because for people who don't meet inpatient criteria, an inpatient criteria would be suicidal ideation, homicidal ideation, sudden onset of hallucinations, delusions, or paranoia, medication noncompliance, isolation, sudden changes in ADLs. Those would meet the criteria for inpatient. But some people have chronic behavioral ongoing issues where they need the same type of therapy, but they just don't qualify with their insurance for an inpatient stay. So I was going to turn it over to Sarah Peace and let her just tell us about her IOP and PHP programs that can complement what we're doing inpatient.
Thanks, John. Can everybody hear me?
Yes.
Okay, good. So my name is Sarah. My phone refuses to let my camera go on, so that's probably an okay thing. Y'all wouldn't have to look at me. But anyways, I'm just going to tell you a little bit about our outpatient at Creekside. I'm the director of clinical and outpatient services. So anything I say that pertains to outpatient, you can also send me questions about things that pertain to inpatient therapy as well, as I cover both. So at Creekside, we have two programs on the outpatient side. We have one called PHP, or partial hospitalization. And what that program is we do ages 13 to 17. I'm working to extend that down to the age of 12, but currently we take 13 to 17, and we take all insurances except for the Virginia side of things. And PHP is a 5-day program. It lasts for about 3 weeks. It can be extended just based on the clinical presentation of the adolescent. But it includes medication management. It includes individual therapy. We actually do family therapy on the outpatient side, whereas on the inpatient side, we do what's called a safety planning session. So it's not necessarily family therapy. But on the outpatient side, we do, since we have them a little bit more longer, long-term, we actually do the family therapy, if I can get my words out. So with the PHP, like I said, they get medication management where they see a provider once a week. They see a nurse every single day. They get individual therapy. They get group-based therapy. They're on site from 9 o'clock a.m. until 3 o'clock p.m., Monday through Friday. And then they get the family therapy if that is something that they request. And it's 3 weeks long. I always say that it mimics our inpatient structure on an outpatient level because it's pretty much the same. It just keeps them from having to lay their head in our facility if they can keep themselves safe. We do take quite high acuity in that program. So if you ever have a kiddo that comes in or that's referred to you or that you're seeing that you feel like might meet criteria, the best thing to do is just ask, and you can email me. I think John is going to maybe put a flyer up that has my email, but I can drop that info into the chat box as well. My team has emails, so we're very easy to contact. There's never a stupid question. So we get referral questions all the time. Hey, I'm seeing a kiddo that has these behaviors going on. Is that something you guys can take? 9 times out of 10, it is. We normally like to give them a try since we are the only PHP program in the area. And we do assessments on our own. We schedule assessments for folks. So it maybe takes about an hour to get the assessment done. So it's not a long wait time for the family to have to deal with that. They can do the program by Zoom, telehealth, or they can come on site. If they do Zoom, which usually we don't recommend Zoom for adolescents, it's a little bit tougher to keep focus. But if that is something where they have transportation issues or other things at play, then we will allow them to do Zoom. There's requirements for them to do Zoom as far as the programming, for them to have their camera on. There's activities they have to complete and turn in so we can make sure they're actually gaining things from the program. But that is from 9 to 1:15, whereas the PHP program is 9 to 3 daily. So that's PHP. Does anybody have any questions about partial hospitalization? Okay. So the second part of this is kind of the step down, right, from PHP. So it is called IOP. It is intensive outpatient therapy. I'm sure many of you have probably heard about it because I think there's a couple IOP programs in this area. Our IOP program is, of course, for 13 to 17 years old adolescents, but it is group-based therapy. That's really what they get with it. We use it as a step down from PHP, step down from IOP, or they can just walk in from the community, say that they're getting individual therapy, individual med management, and they just need a little bit more on top of it, they can come to IOP. Or if they need kind of that group dynamic, that's what IOP is there for. It doesn't have individual therapy, really. It is just that group-based therapy piece. Right now, we are offering it during the day, Monday through Friday. They would just pick the 3 days they want to attend. because it's offered every single day. Some of our kiddos actually come 5 days a week right now who do IOP. That program is a 5-week long program if they do 3 days, and it is a 3-week long program if they do 5 days a week. The IOP program, like I said, it's group-based therapy. Normally when school starts, it's after school program. That's what that one is. PHP is during the day, and they would not go to school. They do have a period set aside for school education while they're with us, which is of course for your higher acuity individuals. But IOP, they're allowed to go to school, and they come to us after school, and they can do that by Zoom, or they can come on site. And we do set up transportation for them. The program hours for IOP are 5 p.m. to 8 p.m., Mondays, Tuesdays, and Thursday nights. And like I said, we can set up transportation for that program as well. And that's about it. We do offer programs for adults as well. So if you run into an adult or a parent of a kiddo, we've had this many times, that needs some type of mental health care, whether it be PHP or IOP, we do offer programs for adults. And actually in about 2 weeks or so, we are going to have transportation. I think we're aiming at August 1st potentially, but we're going to have transportation set up. So a Creekside van, it doesn't have any markings on it, just to kind of keep that private, but it will be coming up to East Main Street in Johnson City and picking up any patients that want to come, adult patients that want to come to our outpatient program and are enrolled in it. So it'll come up there, and that's free of charge for anybody who's interested in that. If you have adults that you see, we take all ages of adults. And the programs are very similar for PHP and IOP for them as well. We have had parents program who their kids are with us in adolescent PHP, and they program in the adult program. So that is an option. Does anybody have any questions for me? Okay. Well, thank you all for listening to us and allowing us this time to speak with you today.
Thank y'all so much for being here. Just a reminder, I did put the information that John shared with us in the chat, the link to that. So there's a referral form and lots of different information on that link that you all can access that way as well. Any questions for them before we move on?
Hey, this is John. There's 2 more things on that. One is we give a certificate of completion, which can come in handy for adults that may be a court order or an employer ordered type situation where they need to do something for self-improvement. If they run that through the court or their employer, we do get a certificate of completion after the IOP or PHP. And they can also come back for 12 months for free for 1 session each month to reconnect with a therapist or med management person for follow-up care. So I wanted to mention those 2 things.
Thank you. Anything else for them before we move on? Okay, we've had several folks join us since we talked about our events and activities. So I wanted to give one more opportunity for anybody else that has something coming up and would like to share that, to go ahead and do that before we go into our breakout rooms. So if you have anything coming up you want us to know about, feel free to share it now.
I don't have any events coming up, but I'm with Tennessee Voices Survivor Connections program. And I know a lot of you are probably familiar with the program, but the program has changed a little bit. And so if it was okay, I was going to take the opportunity just to explain what's changed. So our program was 0 to early 20s, anyone who could be referred. Now there's no cap on age. Anyone who's been the victim of a crime can come into our program with a referral. So it's still a 90-day program. And we are actively seeking referrals. So all of my information is in the chat. If you have any questions past what I've explained, I'll be glad to answer any questions you've got. If you're wondering how to do referrals, I'll be glad to help you there too. Thank you.
Anybody else have anything they want to share? Move on. Okay, well, I will go ahead and open up our breakout rooms. Just quickly for anybody that hasn't been here before, or anybody who needs a refresher, our committee A is our substance use and mental health committee led by Rick Jones. Committee B is our Community Action and Awareness Committee led by Shannon Payne and Scott Stadola. And then Committee C is our Community Assessment Committee led by Emily Brooks. So again, you can refer back to that strategic plan we just created to see exactly what each of these groups do, but you're welcome to join any of them. So I will and Hi, Brooke here. Change locations. So in Committee A, we talked about International Overdose Awareness Day and kind of cultivated some ideas that we could ideas for International Overdose Awareness Day, just how we can kind of implement that as kind of honor the lives that have been lost and offer hope. It's a little crazy here. There's literally a dog right here. So yeah. But yeah, so we talked about that, and then that's pretty much all we did. Thanks, Brooke. It's Sports Physical Day at Carter County Drug Prevention. So all the children are here getting their sports physicals. It's very fun. Good times. Okay, Committee B, Shannon or Scott, do you guys want to share? We expect as much excitement from you guys as we had from Committee A.
Sorry, not a lot going on here. Yeah, we talked about several different things. I was late getting into the meeting. I was having technical difficulties, but yeah, we talked about several things. We have some new members to our committee, and Kathy is going to get our Peak Mentor application and pass that around to in her Northeast banking system right there. So we got a few things. Scott, do you have anything to add?
We just basically went over the strategic plan about the faith-based community initiatives that we're in the process of getting in place. It was also brought up about trying to incorporate a message of prevention, a message of hope to those that are in the school system at all the grade levels. And I know that was an idea that we had talked about in the past. It's not specifically mentioned in the strategic plan for the Community Action Committee, but it falls in the line with the community action and getting that message out to as many people as possible. So not just with the faith-based communities, but also with our school district, Carter County and Elizabethton. So being able to get that message into the schools in the coming school year will be huge, and just that message of hope, recovery, and providing the resources for those that need it will be huge in our community. Because
You're muted, Scott.
well, I don't know how much you heard of that or how much you didn't hear about that. But anyway, we're going to try and get that message into the schools as well as the faith-based communities. If you have any information that you'd like to share with me in the Community Action Committee, I will put my information in the chat box, and feel free to reach out to me.
Thank you, Shannon and Scott. All right, Committee C, y'all want to share an update or anything you need from the full collaborative?
Yeah, so one thing we're working on in Committee C with our strategic plan is branding for Carter County Collaborative, trying to get a logo, to get colors for us, just so the community knows who we are. So Jane, I put a link in the chat. We've kind of worked on this logo, and Jane really helped a lot. And that's kind of what we're going for, but we're going to start exploring how to actually get that logo, see if we can get it, for free. If anybody wants to reach out to me that can help with designing a logo for free, but this is kind of our inspiration here if you click on that link. And the blue and the yellow are our colors that we're kind of leaning towards. But hopefully we can get something together and bring it up to the full collaborative for a vote at the next meeting.
Thank y'all so much.
Administration.
Sorry.
Yeah. What?
Go ahead, Emily.
I was just gonna say, we'll work behind the scenes before the next meeting with the leaders of all the committees and see if we can get that, and then we'll vote on it as a full collaborative before we move forward.
Thank y'all so much for working on that. All right, anything else before we wrap up?
I have a question. This is Bill Fryer. I'm curious about the Bipartisan Safer Communities Act and the funding that substantial funding that is coming from that federal act, that federal law, and wondering how the various parts of the collaborative will be involved in receiving and spending that money. Is that something that will happen right away? Is that something that takes weeks and months to apply for or get the grants turned in? How does that work?
It will probably take a while for it to kind of trickle down to us, but it's absolutely something that we would look at, and think it would be a great fit for us as a full collaborative to potentially, apply for some funding for that. If y'all don't know what that is, it's kind of an attempt to advance the president's agenda to expand access to mental health, addressing gun violence, those kinds of things, and then also just increasing access to telehealth services. So it'll be around $250 million. I don't think that it's been stated yet exactly how that's going to be distributed. But yes, absolutely. Thanks for asking that and kind of putting it on our radar. And as we get more information about it, we'll continue to look at it and talk with everybody about it.
Thank you. Thank you very much, Jillian.
Okay, friends, anything else before we go? All right, friends, thanks everybody for being here. I appreciate all of you and the amazing things you do in our community. And we will see you again next month. Bye.
Everybody have a blessed day.